Good morning, friends. I am Professor Manokar from Chennai. Today I am here to discuss a few relevant aspects about COVID-19 and hypertensive patients. We all know that hypertension is the world's commonest endemic disease and in terms of prevalence, and today COVID is probably the biggest pandemic that we have faced in our lifetime. So obviously these two things have a relationship, and it matters, and how it matters is what I am going to discuss today. Hypertension is important because it is probably one of the commonest comorbidities seen in patients having poorer outcomes in COVID infected patients. So it is important that hypertensive patients take extra precautions to avoid COVID infection, and at the same time also take care in case they develop a COVID infection. So three relevant points that I would like to stress upon today. Number one, drugs. Every patient who is on hypertensive drugs should continue to take all their antihypertensive irrespective of the other issues, lockdown and anything. So they are going to take their medications without any stoppage. Special concern is about people who are taking a group of drugs called ACE inhibitors and ARBs. ACE inhibitors are drugs like enalapril, ramipril, lisinopril, and ARBs are drugs like telmisartan, losartan, olmesartan, valsartan. These group of drugs were initially, there was a concern that these drugs may increase the incidence of infection of COVID-19. All these controversies have been laid to rest. If you are taking this medication, please continue to take them. All the health societies across the world endorse you to continue to take these drugs indefinitely. Number two, patients who are hypertensive need to take have salt restriction in their diet, but there is no restriction on fluid intake. So people, unless they have extensive heart disease or people have kidney disease where they asked to restrict fluids, most of the other hypertensive patients should continue to take plenty of fluids, liberal intake of fluid, to help them overcome the viral infection when they develop it. Point number three is patients with respect to chloroquine prophylaxis. Whether hypertensive patients can take chloroquine prophylaxis, the answer is yes. It is pretty safe for hypertensive patients to take it. Whether they will benefit by it is a matter of deep debate and controversy. Many people debate its efficacy, its role in asymptomatic people, and whether it may be beneficial in the long run. But that is to be decided by your healthcare provider. But if you ask me, is it safe? Yes, it is safe to take unless you have extensive heart disease or you have retinopathy where the hydroxychloroquine may be detrimental. Other patients should continue to take hydroxychloroquine for prophylaxis if deemed appropriate. The fourth issue is cholesterol lowering drugs. There are some concerns that cholesterol lowering drugs will aggravate the symptoms of COVID-19. So in case you are taking high dose of cholesterol lowering drugs like statins, it may be prudent to stop them in case you develop an infection, and withhold them for 2 to 3 weeks till you recover from the symptoms. Thank you.